Now, the South African Emergency Personnel's Union, SAEPU, says it is concerned about government's state of readiness for the much-anticipated third wave of COVID-19 infections. The union says that it is urging government to purchase enough personal protective equipment to ensure the safety of emergency service workers. Most alarmingly, the unions say that when the third wave hits the country, it expects emergency service workers to be forced or even intimidated into risking their lives to treat patients with COVID-19 without sufficient PPE. Mpho Mpogeng is the president of SAEPU. He joins us now to discuss this. Mpho, thanks for joining us.
Thanks for having me.
Please elaborate on your concerns that government might not be ready for the expected third wave of COVID-19 infections. Are we still talking about a lack of PPE for emergency service personnel?
Yeah, I think that is a very good thing that we have to share with the public. Firstly, let me indicate that since from the beginning of this COVID, government actually kept on telling the public that they are ready, but in actual fact, they were not ready. The reason for us to alert or to indicate to them that they must prepare themselves is because we don't have to deal with this matter more or less the same like before. I must indicate that in the past, they indicated that they are ready, and at the end of the day, our members were actually forced to actually attend to emergency or maybe positive COVID patients without PPEs. So it was a very difficult moment because during that particular time, our members were having only maternity aprons. And again, we must also emphasize or indicate to the government or the department that they must start educating their managers, because most of the managers, they claim that maternity aprons are PPEs. So we're sitting with so many cases that we have encountered where our members were pushed to attend those incidences. I must indicate that we were also having one member that we've lost because he was given a plastic to go and attend to a PPE positive patient. So it is a very, very worrying factor. That is why we are saying to them, they must stop misleading the public that they are ready, while we know that they are not ready. In other provinces, we don't even have a team that is basically dealing with the positive COVID patient. So it is very, very difficult. Because when you approach them, they will tell you that they are ready, but when coming to the actual cause of COVID, they are not. So at some stage, we are also running, as the organization, as SAEPU, we are running as call centers because our members are now calling us before they can take those kind of calls because they are pushed. Every time when there is a when there is a COVID patient, mostly our members will just call us. We don't want that kind of a situation where people are going to be forced and so forth. Again, we're also talking about the issue of vaccination. We're seeing, we've been observing a chameleon pace, the locomotion of a chameleon in the department, where our members, more especially the frontliners, I'm talking about the ambulance workers who are always at the forefront, who are the first contact. They don't, when we speak, out of 10, it's only one who are actually vaccinated. So the system, because they're always claiming that their systems and everything is ready, but if you can check the website that they are using, is a fraud, because most of our members, they were interested, they were intending to register so that they can be vaccinated, but the system is failing them again. So we can easily see that this thing is the biggest problem that we're facing, because in an actual fact, our members are struggling, and while on the other side, they were told that everything is ready and people are ready to deal with that. So that's why we're engaging them, we're actually alerting them, because we know that they are always not proactive when coming to issues. But when coming to the public, they are very, very bold to say everything is okay. So we're saying again, must actually come up with the teams that are going to deal with confirmed positive patients. If they can have teams in various districts in all corners of the provinces and country, obviously they are going to save money, because it's not going to be difficult for them to dispatch the limited PPEs that they are having. Only people who will be dealing with confirmed cases, they will be actually issued with the very same PPEs. Not everybody, because the very same PPEs, the managers must start to distinguish that there are PPEs that are given to data must be given to people who are suspect, and the PPEs that are given to people who are confirmed.
Okay,
positive.
Mpho, let's try and have a conversation so I can ask you a couple of questions so we make sure that we cover everything. When we're talking about emergency services, are we talking about those that are the first to go onto any form when an ambulance is called, they arrive at a patient's house or wherever they may be, and then they have to treat the person all the way to hospital? You're saying that they have no PPE even today as we speak. I mean, is that still the situation now, or are you worrying about looking to this third wave? Let's talk about now. How is the situation right now?
We've also seen that the waves have actually there is a drop or decline in COVID. So now we are saying our members, people in other provinces, our members are not having full PPEs, more especially for those people who are confirmed as confirmed positive COVID patients. But in other areas, yes, we can confirm that they are having PPEs. So the reason why we are raising these issues is because we don't want a situation, more especially to those provinces that they don't even have teams in various districts. We are saying to them, start working from now, because we don't want to see a situation whereby we're dealing with the COVID more or less the same like before. Because every time when you engage, even if you can talk to them now, if you can pick each and every MEC from whatever province, they will say they are ready. But when coming to practical part of it, they are not. Because at some stage, if you can check, for now, while the COVID is not yet, it's still low or moderate, if I can say so. We've seen that in other areas, they don't have a full PPE that is required to treat a positive patient, confirmed positive patient. So that is the biggest problem that we're encountering now.
And it is a big worry because, as we've been alluding to, there is a massive threat of a third wave coming into South Africa. The vaccination drive is at a very, very slow pace right now. You have alluded to that as well. I just want to get to that part where you talk in terms of some of your worries, where you say that EMS workers will be intimidated to work. You use the word intimidated. You also make a statement saying that they are always reactive instead of proactive. So who will intimidate you to work, and who are they that you are referring to?
I'm referring to the managers. The managers in other provinces, where they will just tell people, they are putting our people between the hard surface and so forth. Because the reason why I'm raising that is because they are sitting at home, most of them. And if there is a positive COVID patient, they actually instruct our members, while they know that they don't have the full PPE. They will say, just go there, and if you don't go there, you'll be charged. I'm sitting here because we are still having lots and lots of charges from other provinces where members were intimidated and forced to take COVID patient. I'll give you an example again about the very same guy that I spoke to from Eastern Cape. He was given a plastic, he was forced, and he said, there's no way, because I'm going to lose my job, I'm having a family, so I must respond. And he responded, and after some time he was positive and eventually passed on. That is the situation that we are facing. And now, when coming to the issue of the very same vaccine, we have seen most of the managers who are staying at home during the peak of this pandemic, they are the first who are getting a vaccine. So it is a worrying factor to us to say how possible it is, because those people are sitting at home with their laptops, cell phones, instructing, intimidating members are the first. So now if you can check, those people are getting first preference while they are not at the forefront. People who are at the forefront, they are not getting that. And we must also guard against the issue of vaccinating our friends and families, because now is the language that is spoken out there is that they are giving the public sort of a message or example to say leaders are there to vaccinate. But if the very same third wave kicks in, you see the very same leaders at home not doing anything. The very same people who are not vaccinated, they will be at the forefront dealing with that. So that thing must come to an end, because you cannot allow that to that particular level. It must come to an end. You must talk about it as well.
Do you have evidence of this happening? I mean, I know that, as you say, it has been spoken about, that you're seeing some medical professionals that have been trying to skip queues and who have skipped queues, and they've gotten their spouses and families to be vaccinated who are not on the medical front line. Do you know as a fact that this is in fact happening, and members that are part of your union, the medical personnel, the emergency personnel, are pushed to the back of the queue in favor of wives or family getting vaccinated? Do you know of stories like this?
Yes, we know stories. I can confirm. We know those stories. They are there.
Yeah.
So yeah. we are saying that thing must come to an end, because we've seen so many people who are not the frontliners, who are at the forefront dealing with being vaccinated. So it's a worrying factor. And our members, when we talk to them, they say no, we've logged into the log website, that thing is not working, and so forth. We're waiting. So it's a problem that needs to be dealt with.
Just finally, you've spoken to the lack of PPE, which is worrying, especially now. I mean, we've been dealing with COVID for a year now, and we've been promised that this is at least something that we've gotten to the bottom of, and that emergency personnel have got this, but you're telling us that they don't. What about the state of ambulances and the state of the equipment that you use? How is that, very quickly, what is that like at this point?
We've been talking about the shortage of ambulances. You go all over the provinces. Now the only province that must be precluded or excluded from this is only Gauteng for now, because now they are thinking Gauteng in terms of vehicles, they are at a better stage. But in other provinces, it's a disaster. That is why we are saying people are doing, we as ambulance or EMS workers who are participating in spreading the virus, because the ambulances are still doing more than 2 calls per single trip. We're calling them collective trips, where one patient will be collected from another area and be something of that nature. So in that particular instance, you'll find that there is a positive suspect of COVID, and that person will be transported with the maternity patient. So you can easily see that there is a problem of shortage. That is why when we say the district must have a specific ambulances that are going to deal specifically with COVID patients, the provinces are failing to respond because there is shortage of ambulances. The equipment is a disaster, because at some stage you'll find that ambulances are just running without even the gloves. I know that during the first COVID or wave, our members were given only 1 pair of gloves or 2. I know I'm having videos of that. I can send you that, because people are complaining to say how possible it is for us to run the whole day with 2 pairs of gloves. So that is a very, very serious disaster. So there is a serious shortage of ambulances and equipment, and that was exposed by the very same pandemic, because all along we've been talking about it, but and no one was exposed.
All right, Mpho, I've got to leave it there. I'm glad you've spoken to us. Mpho Mpogeng, who is the president of the South African Emergency Personnel Union, talking to us about their concerns that government will not be ready, and they are not ready as we speak to you now, for this anticipated 3rd wave of COVID-19 infections. All right.